Hey guys, this is Ron again, and I wanted to tell you this is about to be another nursing story time. So today, I finally had a day off, and I was just like, all right, had a doctor's appointment today, and had to get that situated so I can get like a referral, and then end up making plans with some friends that's also nurses. So I went out to this bar, and you know how in nursing school you have like a few friends that you're really tight knit with. Ironically, it's some of my friends that I spent my last day at college with, and we all ended up working in the same place. So that's great. And but one of my friends, me and her have been together since freshman year, and we're really close friends. And it gets down to the point that we just need to look at each other and don't need to say anything, and we both thinking the same thing. So that's real friend, close friendship right there. We just been around each other and know how each other thinks. So we was in this bar and we was eating, and we heard this baby coughing like like very deep and raspy, and we was just we heard it, and we was just and look at each other, we looked at the baby and then look at each other, look at the baby, look at each other, and we was just we're going to hell. So we was just that baby has croup. And if you don't know what croup is, it's like a upper respiratory infection that happens in infants, and especially ooh, it was so bad. We was just were you thinking the same thing that I was? It was yes. So the definition is an upper respiratory infection that blocks breathing and has a distinctive barking cough, and that's exactly what that baby had. It sounded exactly like it, and croup is caused by various viruses that can be spread easily through coughing, sneezing, and respiratory secretions. And we was just that baby sound like it had croup. Let me see. What's preventative? Croup developed as a cold or flu virus. One of the most effective ways to reduce the risk of croup is to teach children to wash their hands. Hand washing. So either the parents are not washing their hands right, or whoever the baby is around is not washing their hands. Basically, that baby had a barking cough. We was just see, you, especially when you're in public, your assessment skills and what you hear and see, you start noticing a lot of stuff as a nurse, and sometimes it's just really bad, and you just ooh. But yeah, nursing, it definitely opens your eyes, and you start to see more stuff and be able to, your assessment skills is used in your personal life as well, I feel because we was just when the baby started coughing on his way and the parents was holding the baby and they was walking out, we was just ooh, okay, yep, that's what that sounds like. And I was just and I'm I haven't, based on, it has a distinctive sound. And I was just for a baby that looked like they was probably between 4 to 6 months, definitely can't be more than 7. Definitely. I was just listening to it. I was just what? But yeah, that's just my little nursing story time. Quick little blurb. I hope everyone is doing well. Um, Definitely, even though you're not really in a nursing specialty, you can pick up on a few things. If you have some exposure to it and what you learned from nursing school, you can still use that in your practice. You can use that to help people, even though that's not what you're really focused on in your profession. But it's just it's weird how much that you can retain from nursing school, or just from experiences and other health conditions, or even if you YouTube conditions and you can see what it sounds, see what it looks like, see what it sounds like. You can really just pick up on those things, and that can just help you become a better nurse. So yeah, that's just what happened today. I just thought it was pretty funny. Well, not funny for the baby, of course not, but just funny that after this time, you can pick up on stuff like that. Even though when you're around other nursing people, we have some really bad jokes, really, really bad. But it's just based on our experiences. You have to find a way to cope. I know we crack up. Ooh, where did that? Oh, we crack a lot of jokes in on my unit, and like people call me sassy all the time, and I was just like, I was never called sassy, but I do know I have a mouth. Never use it against the patient. Never used it against the patient unless I had to say it nicely. But like some patients are very like think nurses are their maids or like their what's that butlers and everything. It was just like, no, we're not doing this. So I might have to set the record straight a few times, but I never use my mouth. I only use it, to be funny, unless I need to use it to prove a point. But I don't do that in the hospital. But let it be outside the hospital, it's a different story. But yeah, I hope everyone is doing well. Like, keep on pushing through your semester. Like, you're almost there. If you're studying for NCLEX, good luck. 75 to 100 questions a day. Like, don't kill yourself. Know your limits. If you're already a new nurse like me and in the same position, like, I've been a nurse. It's about to be 2 months next week. 2 months next week? Let me see. Yep. It's going to be 2 months next week that I've been a nurse. Well, a working nurse at my hospital. Been a nurse for 2 months in my hospital, and like it's going well, and it's also some challenges, and it's getting better. Like the beginning stages, I would have to say is rough, and then like it does get a little bit better. Like I feel more comfortable with myself being by myself as a nurse, and know like my floor is really good at like if you have questions or if you need help, you can rely on people. I'm learning to delegate certain things if I don't have time to do it myself or I just need help. Um, what other things? Delegating is very important. Like now I understand it more now because it's just like you can't. As a nurse, it's just like you have to give meds, you have to like do vital signs every so often. You have to check and assess for like bleeding after a procedure or you have to place like you have to be like the middleman between the medical service, the social work, the nursing home. Um, what other things do we do? Other units, like get the information from them or pass the information along. It's kind of hard. I find it really hard to like understand the full grasp of a patient sometimes, like the full picture, because like you can see like, all right, they come in for like a flu and their own droplet precautions. All right, so they're gonna have like a cart outside their room, and then like you also have to be like, all right, so they have hypertension, hyper cholesterol, asthma. So like you automatically think, okay, so they're gonna have like routine nebulizers to open up their airways. They're gonna have like metoprolol for hypertension. They're gonna have a statin drug, atorvastatin, yeah, to like decrease their cholesterol in their blood. It's just like you start catching on, you start using those critical thinking skills, and like it comes with time, but like it does get better. And then just also learning like how to talk to other professionals, like trying to figure out what from your assessments, how can you best help the patient? Like what information is like social work missing, or what information is service missing, or if you see a dramatic change in your patient, like you automatically want to contact service and see what they think, or if you not sure what you're hearing, like for respirations or heart rate, get a second nurse to get that help. So it's just like I always like, all right, I'm not sure about this, so I'm gonna like ask a second nurse to opinion. And I do notice sometimes that nurses that have been working for years, they sometimes notice things, and I'm like, as a new nurse, it's like fresh eyes, and like especially if you had a patient for a while, like if you had a patient like a lot throughout your shifts, you can notice like changes, and then some people might not be worried about it, but you are. And I noticed that like one patient, he was like just declining, and like he was just not his vital sign. And the weird thing is, vital signs can be perfectly fine, but I was told if you ever think something is wrong, more than likely you're right. So don't be afraid to call your rapid response team. Don't be afraid to like contact service. And that comes with advocacy in nursing. Like I not especially like sometimes I'm not sure and something doesn't feel right. And it's okay for you, like I think you just say that you're concerned, you're worried. Why are you worried? Based on your assessments, you bring that up, all that information, and see what can be done. Like, don't be afraid to speak up. That's what you have to do as a nurse, and I'm starting to learn that now. Um, yeah. Hope y'all have a wonderful weekend. It's Friday. Is it Friday? I honestly don't remember. It's Friday, right? Yeah. I don't remember days. I just know the last 2 weeks I've been working like I only had 2 days off since before yesterday. I only had 2 days off, and I started working like that many hours like the Monday before last. So it's a little bit rough right now, like little bit rough, but it's good. I think the one thing I do need to do is like try to find a way to like have a work life balance. Like on my days off, I say no to so many people, and it's probably in like I'm working out, but like I do need to like just get out of my apartment sometimes. Like actually, I need to get out of my apartment more, just so like don't start getting really introverted and like just going out and just meeting people. It's really hard because when it's cold and like a work day, I am not that sociable. Like I do not like winter. I do not like the cold, and especially if it's snowing and windy, you're not gonna see me. But I'm gonna try to work on that. That's just one of my goals right now. And went out like last night. And then I went out with a few friends for like some food and like a few drinks, and it was very casual. Yesterday, it was just like did not plan for this and woke up with a hangover. But yeah. I mean, sometimes you just need a break, and you got to do what you like. You just need to find a balance, and I feel like that's something that I'm working on. Like, and then finding like cost-effective ways to hang out with people and finding that time for yourself. So, see, but talk to you later. Bye.